It used to be that if you had a hip problem before you were old enough to have it resurfaced or replaced, your options weren't too enticing.
Early hip treatments for these people that were not quite ready for a replacement or resurfacing but still had significant pain or deformity, we would actually go in and open up the hip joint and then reshave it, recontour it, take out tears, take out loose bodies. When you open a joint like that, you make it more susceptible to other injuries. You're cutting off the blood supply for a period of time, which can lead to problems. So you don't want to open up the joint if you don't have to, unless you're doing something more serious like a replacement or resurfacing.
In recent years, Dr. Philip Schmitt and the orthopedic team at Huron Valley-Sinai Grace Hospital has had an ongoing role in the evolution of hip arthroscopy.
We've done knee arthroscopy for 25 or 30 years and are very good at that now. We've done shoulder arthroscopy for the last 15 years or so and have developed a lot of techniques for that. Hip arthroscopy is really a newer technique, which is basically taking a hip joint, making some small incisions or portal sites, and putting a camera about the size of a pencil into the hip joint. With that, we're able to also put in little shavers, little graspers, and things like that, and treat conditions of the hip, which ordinarily or beforehand we were not able to treat. In general, the type of patients we see are late 20s, 30s, early 40s. They're still people that are very, very active, work out a lot. A lot of them do high-impact sports where that condition will bother them when they're performing their sports or activities.
One such patient is Gary Stoneback.
Well, my quality of life was good, but a lot of the things I like to do, if it's basketball, soccer, taekwondo, I was having pain. And in that regard, the quality of life wasn't so good. And knowing I wanted to keep doing that is kind of what brought me to Dr. Schmitt.
These patients tend to have intermittent pain. They have pain in the early stages with certain activities or certain positions that they get in.
If I would do something, I would have issues for like a day or two of some tough pain, and then it would take me a couple days to recover, and it was just an ongoing cyclical thing.
A number of things can be causing pain, a tear of the labrum or a meniscus being pretty common. Let's take a look at Dr. Schmitt as he performs hip arthroscopy on another patient with a similar injury. Using a traction table, Dr. Schmitt creates a gap between the femoral head and the acetabulum, also known as the ball and socket. He uses a spinal needle to create a path for instruments to slide in. He then inserts a guide wire into the newly created gap. After clearing out the blood, he adds water for two reasons. First, to help spread out the joint to provide more room to work, and second, it helps stop the bleeding. Notice the feathery material? That is a torn labrum or a meniscus. Dr. Schmitt then cleans it all up using a 3,500 RPM shaver. Once removed, the torn muscle is drawn from the body, leaving smooth surfaces, thus ending this patient's pain and irritation.
That's nothing else floating in the joint? Yeah.
I was actually really surprised by the recovery. You know, within a day or maybe 2 days of both sides, I was off crutches. I felt good enough after even a week to go out and probably do some things I shouldn't have been doing.
Patients begin physical therapy immediately to improve range of motion and strengthening. Most people return to their normal physical activity or sports training in a 6 to 8 week period.
I usually start people in physical therapy shortly after to help with range of motion, to help with strengthening specifically, because they tend to lose their strength when they're not doing their sports activities. But most people within a 6 to 8 week period are returned to some degree of their sports activity or training.
And what would Gary Stoneback say to other people who suffer the same problem?
Get it done, because if you wait, it's just going to get worse. And the sooner you get done, the quicker you're going to be back to your activities.
And Dr. Phil Schmitt and Huron Valley-Sinai Hospital is a good choice to make.
It's a great hospital. Nurses were excellent, doctors were good, anesthesiologists were good. I had a good experience.
To find out more about hip arthroscopy or to make an appointment with Dr. Philip Schmitt and his team at Huron Valley-Sinai Grace Hospital, log on to dmc.org or call 888-DMC-2500. I'm Emery King.